Well, hello and welcome to the Coaching Center podcast where we empower individuals by sharing stories of entrepreneurs and powerful people with powerful stories. And today we have the great pleasure of having Dr. Maria Lange. Hello.
Thank you. Thank you for the introduction. I'm glad to be here.
Yes, I'm glad you're here. So start off by telling us about your organization.
Well, I am an entrepreneur in health and wellness, and I've been in the medical field for 30 years now, and I'm still learning.
Yeah, I love that. I love that.
And I am an alternative and holistic physician, which means I treat the body as a whole, body, mind, and spirit, and emotions. I also do functional medicine, that's part of it. Again, treating the body as a whole instead of an individual symptom. And so we treat root causes of all diseases.
Awesome. So why? Why did you get into this profession?
As I told many of people, I accidentally got into it. It found me. I didn't find it.
That's usually how it happens.
Yes. It started way back with my pain when I was a child. I grew up with back problems, almost paralyzed from the waist down twice in my life. And I was given a corselet, which is a brace from the waist down. And I do have juvenile rheumatoid arthritis, which is a joint disease, and Addison's, which is an adrenal insufficiency with the endocrine system. But getting back to my pain, where it started me off, and my initial journey was when I was 17 and sat down with that physician with my sister, and he said, for the rest of your life, you are going to be limited in a lifestyle. And no kid, you will not be able to have a kid, you will not be able to be active, you will not be able to run and do a lot of sports.
Early on, they told you all this early on in your life.
Yes. And I've told this many of times in the last 30 years, different things, and I have proved them wrong.
That's right.
And that's exactly why I'm here today, to share my stories. So I embraced myself into holistic healthcare from that point onwards. I then, at a young age, started massage school, and then I started got my way into doctor's offices for about a decade, and I started just doing all my schooling, became a medical assistant and just little rehab tech working for surgery centers. And so I found people to help me out. I mean, I used to get up in the morning when I was young, and I'd have to crawl with my forearms to roll myself in the bathtub, okay? So just to tell you where I was at. So we can do it. It's who's going to tell you that you can do something or give you the tools. So I promise you, if you work hard at it and you believe in yourself and you stay away from those naysayers, you can do it, because it's all in here. I promise you. Yes. So that's how I started my journey in my pain management practice. And started treating patients with acupuncture. I'm an acupuncture physician as well, a doctor of Oriental medicine. I went over China. When I came back in 2000 from my internship, that's where I got my master's of Oriental medicine, and that's when I started my holistic skincare, my practice. I do my own proprietary blend of a holistic skincare, doing microneedling, hair restoration, and whatnot. So,
I might need hair restoration.
I've told you, you're a long-term patient until I retire. A long-term patient.
Wow. So
it's fun.
It sounds like you turned your pain, or you turned your barrier into a strength.
Yep, like I say, I turned my pain into my purpose. It took me a while to figure it out. I was fighting it, and even when I came back into the States in 2000, and I opened up my private practice, and it's in Lake Mary, Florida. When I opened up my private practice, I came back with mercury poisoning.
Oh, jeez.
So, yes, just to top it off. And then I went into the conventional world, which, as I was telling you last time, I took the blue pill, or you want to take the red pill. And the blue pill is conventional medicine, where they treat with symptoms usually. and symptoms and diagnose. And then the red pill is you're going to keep on looking for a better path, doing holistic medicine, alternative, finding the root cause of the disease. And have I, like many other people in this world, have I done the blue pill? Absolutely, yes.
But can they both be done together?
They can. Absolutely. But my goal was, which I did, was get off that blue pill or that lifestyle and get into the red pill where I'm happier and healthier because there's side effects from the other one. And then I underwent chelation, radiation therapy to get rid of that mercury poisoning. Of course, when you have mercury poisoning, there's just a lot of setbacks altogether. I mean, there's just a dozen on the list there. So it was a big journey. Did I have physicians tell me conventional? And first of all, let me just explain the difference between conventional medicine and functional medicine. I believe that both worlds help. As I stated on my website back in 2000, when East meets West, this would be a beautiful world. But Eastern medicine is your functional medicine doctors. They could be a acupuncturist. They could be they could be a medical doctor, DO. Okay. And then you have your conventional, or another name is standard medicine, okay? So standard medicine, they treat the individual part and by the symptoms. And usually it's give them a pill, right? And then if you would see a holistic alternative physician, functional medicine, they would treat you by the whole body they would look at, okay? So when I lost my train of thought there.
It happens. You have a lot to say. Okay, so it is possible. Using both of them in the same, it works, right? It's like a holistic approach.
Does work. I mean, for instance, let me just give you last case on Thursday when I was seeing patients, blood pressure. I was seeing a functional medicine patient for about 3 months. They spoke to their conventional doctor and they were weaning them off the blood pressure medication. But my thoughts are you always going to be on this statin when I first saw them? Well, that's what he was educated on. So here we are as a functional medicine doctors, we educate you. And that's the toughest thing right now is because, we just need trillions and trillions of lifestyle, health coaches, functional medicine doctors. It's just the knowledge that the patients do not have now.
It's not easy to get as most people think it is. It's really hard to get a hold of that knowledge because we don't know where to look.
They're and not to be disrespectful, they're uneducated. Yeah. So this patient did not know there was nutritional deficiencies. He was under the understanding I'm always going to be on this blood pressure medication. So that's when we step in as functional medicine physicians or holistic physicians and say, okay, these are your steps. Okay. Yes, you started exercise routine. You don't go out and run a marathon, but just start walking, you're good. But just, drinking more water, 8 glasses of water a day is going to make a difference. Sleeping is going to make a difference in anyone's lifestyle because when you sleep, you boost your immune system. You increase your T cells, which are your white blood cells, which are going to help you.
Hear that? Go to sleep. Everybody just go to sleep. Don't go to work. Just go to sleep all day. I love this. You are my doc. That's what I was looking for. I needed somebody to tell me, go to sleep all day. You'll be better. Yes.
So just know that you could reach those goals and just encourage them because they're on this other side where they're getting discouraged. Yes, conventional medicine is very good for emergency situations. I just saw that 72 hours ago with one of my nursing home patients, and she comes in beautiful, but holistic medicine, and there was an emergency situation. I jumped in and helped them out, but yes, it'd be perfect world. It would be a perfect world if we could just work together.
Oh, nice. Well, I like that. So you said the education part. So how do we change that? Because the world I come from, educational health, was not a thing. So how do we change that in our communities and in communities where they don't get enough of that education? How do we make that more available?
Unlimited access healthcare.
Oh.
Is what I call it. Yes.
Okay. Yes. Tell me more.
So per your zip code, you're going to find if you're sick, you're going to get certain care. It's a fact. I'm sorry. It's a fact.
Yeah, I know. I definitely know what you're talking about.
You've shared a couple stories with me, and When it starts when you go see the physician, you look up to the physician. It starts right there when you walk in their door. And it's the type of physicians that you do have, but then it goes to, if he or she sends you out for laboratory testing, it goes to the facilities nearby in that zip code who have, like some people who would have, let's say, cancer, and they will go to another state nowadays, right? They will find the best of care in the family. Shoot, they'll take them by the jet if they can, okay? So her zip code, okay, you got a jet, they're going to take you right there. But let's just talk about the people who don't even have the money for a can of tuna.
Yeah.
Okay.
Well, I have a story for you because you told me this before, and something happened to me this week that proves your point completely. You know I was supposed to get a procedure.
Yes.
I didn't get it. So listen to what just happened. So I was supposed to have a procedure in a clinic, right? I knew the price, what I had to pay with my deductible. Everything was set out. It was $1,700. But at the last minute, the night before, they moved it to another hospital in another zip code. The price went up to $4,800 overnight because now it's in this other zip code. Yeah. And of course, I got upset. How can I mean, I didn't change it. You did, you know? Right. So that proves your point that it really does depend where you are, where you're from, and where you are. Look, my health now I have to wait because I refuse to pay more just because they moved me from one building to another. That's not my problem. I don't want to move. I was fine where we were. And they told me it's because of the bells and whistles. Yep. But I don't want bells and whistles. I just want you to use the knife, cut, and get it over with. So it proves your point, exactly what you're saying. So that's pretty cool. So let me ask you this. What's the best thing about your work?
Best thing about my work is seeing the end results and during the process, the emotion. And that's why I said initially my statement, functional medicine holistic, is we body, mind, spirit, and the emotions.
It's a whole package.
Oh, yes. You know, if you ask me what someone could do today just to start their health off to better, not only drink water, okay? And I'm not going to say exercise. God forbid. Maybe you could stretch. Maybe you could stretch just a little bit, but it's amazing how yoga and meditation, mindfulness is very, very powerful. But just to see them through that emotional process, and then you have to guide them and lead it, and just give them these simple little tools that no one would even think of. Like this girl was depressed yesterday with anxiety. She says, I used to always do this, and it's exactly what's on the list, body, mind, and spirit. You know, and it's really nice to see them during the process, because initially when they come in, they think, okay, I got this, thinking that I could get to A and B. Okay, all right. That's cool.
But that's what they're used to, right?
They accept it, even with the zip code stuff, okay? They accept it. But also another thing is, not only that, but when you get them to C, D, and let's even talk Z, when you get them to their path, I have to tell them, and they're tearing up emotionally in the sense where they're happy, overwhelmed with joy, did not know. They're better than what they used to be before. And that's what happened to me a lot when I first started my pain management clinic. They would come from the emergency room or all over and like, oh, you can't do much. You know, my arm only lifts to here. And
they're used to that type of service.
They couldn't get their arm up the wall or whatever the condition, or I could only move my neck or my back. I could never do this. I could never get out of my car, right? I had to stop driving. Now I can drive. That was one of my other cases of workman's comp. Now I can drive, and I couldn't do that before. But just to see them when they've reached that point and they never thought they would be there, it just, the life in them, their eyes, just the sparkle in their eyes, they're much better.
Now, something else, like you've had all this background, these barriers with your health. Talk about your marathons and all that stuff, like, because you told me so much. No, first say what you've done.
I'm telling you, if you look it up, it's really, I mean, you can do it. You can do it. Don't stop. Set your mind. I mean, there's just tools, yes, you got to use. Write it down like I told you last time. I use my bathroom mirror. I just write down 2 things. I stick to 2 things. So, I mean, I used to do the list of 100 things I want to do, but that doesn't work. It's too overwhelming. You know, just 2 things you're going to focus on, what you're going to do. Go back to it in a month, and how did you do? And that's what I had to do. I did, yes. for 20 years, since 2000. It's been my journey to take patients through my journey. If they were sick, I grabbed them, Dr. Cab. I grabbed them.
You're a healer. You're a healer.
I grabbed them. So I would take them out for 5Ks, 10Ks, and, we'll walk the 5K. Okay. Well, then, I'd convince them to do even half marathons. And I share with everyone my friend who had breast cancer, a survivor, and she, sure enough, she ended up doing a full marathon, long story short, but it was a journey, but she took baby steps in those couple of years. Some people can't look that far, okay? But if you can't look that far, that's okay. Just look up for a couple months, because when I signed up for my half Ironman, I just signed up. I didn't know what I was getting into. It was like, okay, now I realize, okay, you better eat better, you better sleep better, you just better follow the program.
So baby steps. So okay, so if you had people listening now, what would you tell them to start with? What is something they could do right now, small, really small, to start going towards their health?
Yes. Get up every morning. Get your butt out of bed. Get your shoes ready the night before, and your socks, and the bottle of water, and just go walk a mile every morning.
A mile every morning.
Everyone
can do that. Anyone can do that.
And get rid of the cell phone too.
No, but you had a point. You've talked to me about it before, that people are always in their cell phone. How can that be used as?
Oh, it was great, because on my way over here, I was talking to a guy. He goes, "I'm not good at English," and I said, "Rephrase that for me, would you?" So I said, "Look at me." I said, "Don't look in the rearview mirror. Let's talk about where you're going." Okay. He goes, "I can." Yes. And then and that's why I was asking you, is it Surrey or Siri? And I said, Siri.
No, you said Surrey.
and all you have, look, when we were younger, we have to pull out the books, okay? Right now, I don't even know if they're going to have books for school anymore, okay? But all you have to do is ask your phone for, how do I start a good day? It might say, do yoga, drink water, go for a walk. I mean, and I know that everybody's got at least one or two cell phones right at their hip, right? I mean, you got a college dictionary right at you. You can look it up. Let's just say how to decrease my blood pressure. They got basic things. Okay, first see your doctor, okay? But they have basic things there. It would probably say, go for a walk every morning, drink more water, stay away from so much alcohol during the holidays, cut your carbs during the holidays, get off the sweets. It's going to affect your diabetes. I mean, what are we faced in this world? An epidemic of what? Cancer, diabetes, cardiovascular disease. We haven't hit depression yet, but why do we have depression? Maybe because of the underlying root causes of all the other elements I just spoke about. So it's right after you have the information. If you take just a couple minutes a day, every single day of the week, let's just say you don't have to take the time you take texting, because I know those young ones, I mean, you're great people. But I know you text a lot and you're so quick. I don't even know how the heck you do it, okay? Because, I told you, I got rid of my TV, the whole cell phone thing too. But the time that you take texting, you could just go onto Google College, right? That's what we call it now. And you can get gobs of information about your health. There's free apps, I was saying, right? There's just free apps.
Many that we can tell someone.
Nike has a free app that you can use. I forget what it's called, but Nike does have a free app. There's a fitness coach. I mean, yes, I think there's a small fee that you have to pay for, but there's so many apps. On my way over here, when I was trying to help this kid, I just said, Siri, what are apps you could use for learning English better? She just came up. Mine's a he, okay? Mine's a he. He just came. I like his voice, I like his voice, okay? But he came up with 6 different things, and this kid, he's a millennial kid, right? He just like, wow. And then I said, "You want to know another thing?" Because he wanted to get into exercise, and I just said, "Siri, what could I do?" And I showed it to him. I'm just reaching over the front seat while he's driving, but I had to get my few minutes with this kid and help him out.
So yeah, that's actually good.
Here we go.
Yeah, you have to. That's a healer. So so you're saying spend a few minutes to just look up what you want to know, and it's there. And yeah, we're doing it all the time, so why not do it about your health?
Information is there.
How about food?
Food.
Talk a little bit about food.
Well, we don't have 8 hours. We wanted to keep this a little shorter today.
No.
Food. Well, good questions. What could I do to eat healthier? Well, first of all, I think a good thing I've been doing with a lot of people is doing a 10-day detox, or even if you have a lot of health conditions, you're seeing your physician quite a bit, would be, doing a 72-hour sugar detox. Sugar detox. What does it mean? No sugar, decrease the carbs, get off the cheese, right? And the milk. It's not going to hurt you for 72 hours. Even if you did it for 10 days, you're going to notice phenomenal changes. Not only are you going to sleep better, the inflammation in your face, the legs, increased blood circulation. You're going to be in a better mood because all that sugar. I mean, look how many tablespoons a day. What is it? 22 tablespoons a day we take in a sugar. The average person and the younger kids, they say, taking in about 30 plus. I mean, that's a lot of sugar to take in a day times 365 days. That's
So so a 72-hour detox of sugar. What would you say replace it with?
Replace it with, well, what I'm into, I love avocados are good for you. It's a great oil.
Yes.
Okay, so some good potassium. Put a little salt and pepper on there. I do have that. Yes. And then I'm into only organic. The U.S. lags behind from the other countries doing GMO-free, meaning no chemicals in the food, and it is very dangerous with all these chemicals. But
talk about that. You talked about that a lot with me about the food. How
the food chain has changed. It's different from 20 years ago, or when I was, in the 80s. I could go in the garden and just pick out a cherry from sitting on the ground and just eat it, and no, you don't have to worry about the dirt having any pesticides or anything. I mean, look, why are farmers in these, I call them spacesuits, in these spacesuits covered, their head, their hands covered to spray all of these wonderful crops that are going into these beautiful grocery stores, our favorite grocery store, that feeds your wife, your children, the grandkids. And then we're told that you could buy this $8 cleaner, so upsale, right, I call it. You can buy this nice cleaner, buy all the vegetables and fruits that will take off that chemical. Really? Because I met one of those guys and I asked him, I said, well, why don't you just take off the gloves? No big deal. Or just the space. He goes, oh, no. I mean, it was his accent. Okay. No. I go, what's the big deal? You got to spray. We'll just spray your face and spray your hands. No. He says, I would never eat that stuff. So, we lag behind. I find your vendor, I call it. I have my butcher I go to, and my butcher sells the fruits and vegetables. Do they die in just a couple days if you don't preserve them in that Ziploc, container, maybe a little towel? Yes, they do. That's because they don't have all the preservatives in them. So, you were asking me about my diet here. I just keep it really simple. I like to have lamb, chicken. I have grass-fed beef once in a while, not too often. I like my wild-caught fish, my salmon. I love my morning sardines. I can't help it. I grew up that way, so 10 o'clock in the morning, you all better hold your nose. Okay, my vegetables, garlic is a natural antibiotic. Ginger, before I came over here, I made my little concoction. I love this. It's mint, lemon, and ginger. I put it in a blender and I put it on extract and I drink that for the week, just a couple tablespoons of it with water. It helps with your GI system, helps boost your immune system. So these are just natural little tips that we could do for mindfulness.
Nice. I like it. So tell me.
Oh, my vegetables. I do eat vegetables. Yeah, my vegetables. Got to get those in. Okay, my fruits are only just the berry family. I have a very low sugar intake that I take because of my hypoglycemia. But I like the broccoli's very clean, asparagus, your greens, pretty much your greens I eat.
Nice. I love it. So where are you from? Actually, because you said some of the stuff we're talking about growing up, like sardines, where are you from?
I am first generation American and proud of it.
Yes.
I was born in Cleveland, Ohio, and then I moved to a small town called Marion, Ohio, on a farm of 120 acres. And
so you're a farm girl.
Yes. So lots of fruits and vegetables there, and we jump on the horses to, pick the apples for our apple pie. I jump on the horse, no saddle.
I'm gonna say no, thank you. I don't know why horses. You're not supposed to get on horses. They're beasts.
We could talk about pigs too.
Pigs? What do you get on pigs?
No, I didn't get on. I would just give them stuff that would just go bad, just in the.
Yeah. So you fed pigs.
Yeah, when the beer got old or something, you never waste things, right?
Wait, what?
My parents are from Europe, so when they moved to America, they always had us, in the kitchen and everything. And so we had our homemade wine and then our homemade beer.
You would give pigs beer?
Yeah, it went bad. I was just a little kid. I didn't know better, but the veterinarian was there the next day, and I didn't know. I told the story about 20 years later. What happened with that? And I was like...
Did they get drunk? Did they act?
Only the little pig liked all the beer.
Give it to the little pigs too?
To all the pigs.
Oh my God, there's crimes against that, isn't there?
Well, I was raised.
Keep your pigs away from Maria.
My parents came from Europe and during the hard times in the early 40s, and my mom lived in a lot of refugee camps, and I learned you do not waste things. Okay, so I still wash out my Ziploc bags.
Oh my God! So an entrepreneur, huh? So you love being an entrepreneur. We talk about that a lot.
I love being an entrepreneur. Yes. When my parents came over here, they did open up a business, tool and die makers. So I was always, helping out, working. You always had to work.
Oh, so that's what you're used to.
Yes, I'm used to that, being a hard worker, and I always watched my family and, my grandma who came overseas, and she was always such a hard worker. And so the work ethic was really hard. And when you do a job, you do it right. You just don't do a half job. So it's just, I'm really into it.
So you love being an entrepreneur. So, so let's talk about that a little bit. What would you tell someone that is opening a business for the first time? What advice would you give them about being an entrepreneur? What should they expect?
Well, I'll tell you the advice I have told young entrepreneurs. First of all, congratulate them.
Yes.
It's a big step. It's a big step for success. And not only will I tell them they need to sleep and drink water.
Here we go again.
Never tell them to exercise. Don't do that stuff. But I would also tell them that they need to find at least two, the more the merrier, entrepreneurs who've been out there for 10 to 20 years. And they need to get together with them. I always did this. Get together with them every couple weeks, if they can, and just, coffee.
And collaborate. Yeah, it's very important to collaborate with other. It could be lonely, right, to be an entrepreneur at times. So building a community around you will definitely, and it gets hard. Being an entrepreneur can be really hard sometimes.
You're going to have tough points. You need to bounce things back on somebody else, even if it's another business. Having a medical practice for 20 years, you're going to have your challenges. You're going to have maybe the county or state comes in one day and say, okay, this license, there's a little typo, an error, something like that.
Happens all the time.
Yeah, and then at the same time, you're going to have someone at the front desk, John Doe, saying, I had this appointment at this time, okay? You're going to have multiple things going on, but you're going to need to be able to bounce those things back and forth. If you need to go to the bathroom and just do your little meditation breather and count backwards, because you can't make business decisions when you're under that big stress, okay? You do not make a business decision when you're encumbered by so much stress. Back off, look at it, observe it. But here's one thing I did learn from a lot of entrepreneurs, well-known one, is, you focus 5% on the problem and 95% on the solution. I got a problem. And problems are wonderful, by the way. Problems let you know that you're growing.
Yes.
And the more problems you had, I just had a few I was just dealing with just this last few days. And, it's just like, and I keep on telling myself, I'm growing. I got the problem. Because if you don't have any problems, you're not growing. But the thing is, you just got to know how to respond. And if you have to, I love my board, okay? You've seen my board before. My 48 by 48 board I use with my functional medicine.
Flips and...
Oh, it flips, and thank God there's an eraser. But I was using my board. I put down the problem, and I have solution. And who's working with me knows, don't bother me. I got to focus, get the solution, okay? Afterwards, I come out and I go, this is an awesome problem. The problem brought so many better things. And if we can get those young entrepreneurs, don't get so focused at the problem. Let's get into the solution, because I wish there were a lot more entrepreneurs. I mean, because after a few years, I see them get so stuck into the negativity or some of that social media. Pardon me, sorry. And social media to me, I'm not much of a social media person, but for Instagram, for instance, I get all my people tagged who are great entrepreneurs, and that's what I see. I don't see any of the negative stuff, I just block it, and it populates that good, and I'm a person, a lot of people know, I'm into my faith, so, lots of that, and exercise for me, even if it's a brisk walk in the morning, the way you set yourself the first 20 minutes of the day, I have a mindful thing. I'm talking about mindful a lot, but I have my morning routine, my 20-20-20 plan, first thing in the morning. Okay, I'm a 5 o'clock girl, by the way. So 20 minutes of, a journal, prayer, meditation. You got your 20-minute workout, breathing, meditation, and you got your 20 minutes of looking at your schedule, right? Write it down. I like to do it the night before a little bit, because when you sleep, it's going to be in your mind when you sleep, and when you wake up, you're more in an action plan. And then whoever you're going to listen to, whatever entrepreneur who's out there well-known in the world, I just listen to 10 minutes, and I just have my iPad sitting there, and I'm set for the day. I'm ready to go. And that's how I believe you just can't get out of bed as an entrepreneur. Start answering the phone. Stay away from all those devices. Set your mind. That's what it's about as an entrepreneur. You need to learn to set your mind first thing in the morning.
So there's something you said, and it's important. Like, so you take 10 minutes out of your day to listen to someone else, right? To listen to another professional.
Yes.
I did a research in that of leaders, and that was one of their biggest, the biggest things that helped them become leaders. That they would listen to other people outside of themselves. So that's a really good thing. So what is it that's called your 2020?
I like Earl Nightingale. I don't know those of you who are listening. He's still out there, Earl Nightingale. They've changed him. I mean, Zig Ziglar's another one too, but we're getting a little bit.
So it's the 20-20-10 plan is what you call it.
20-20-20 plan. And if I said the 10, what I started doing with some functional medicine patients, I had to drop it to 10-10-10. It's just the time, because people just feel, I can't do that long. Okay, even if you got to take it to 7, you got to set.
You say the baby stuff. Start small. If you can't do the big, start small.
Yeah. You got to remind me. You know what it is? I have to say this. When I first see a patient and I don't feel like they're making much, and they just feel that emotion, right? Because we treat body, mind, spirit. I just want them there now. Like yesterday.
Passion. So you're passionate about what you do.
You've been very good with my time talking to you. Even the last year, you've really you're like, you got to slow it down. And then I'm like, okay, just do these 2 little steps. And I'm getting really good at it. Okay. These 2 little steps, you got to do that and you're fine.
Yeah, because then they get there, right? After the 2 steps, after they see that wasn't hard. Like what you know it's not hard, but they got to see it. They got to experience it, and they experience,
like I write it on my bathroom mirror, the 2 things. Yeah.
Bathroom mirror, this thing must be.
It's like right there. I see it every morning when I wake up, and I pity my cleaning lady. Every time she's got something new, she's got to wipe off that mirror. Well, it comes off the mirror. and like I said before, sorry, moms. You're going to go see it on the wall next thing you know.
Yeah. So let's talk about your business, because I've been at your business. It's a beautiful place.
Thank you.
Very, very beautiful place. I love going there. You got to kick me out every time I go. Mm-hmm. And you have a lot of great things going on there. Talk about some of the things.
So when you walk in, don't let it hit you, but the natural pharmacy is to the right.
Let it hit you. Walk right into it.
So natural pharmacy, what it is supplements, but it's a high-grade supplement, so we call it nutraceutical. And natural pharmacy, I have plans online, Lange's Anti-Aging Wellness, my website, where you could
get your website. What's your website?
Lange's Anti-Aging and Wellness.com. It's my website, where, let's see, if you're looking for a diabetes package, it's on there. Or if you're looking for cardiovascular health, say weight loss, January is a good time of the year for everybody. There's a weight loss package. And by the way, too, just since we're at it, also I have my functional medicine workshop, which is January 14th. I am doing, I was very fortunate to be trained by the functional medicine father, too. That's when I was really sick, and I took a lot of his courses. And I have his program, Metabolic Detox, which is going to be on January 14th, and a couple segments for health and wellness. If you're up on the website, you could check that out and sign and reserve your seat. And jumping back to the natural pharmacy, like your high grade, good grade fish oil, when we were talking about the quality of a product, we don't want quantity. We don't want quantity. That's what I promise my patients. It's the quality of the product. Because if you get a fish oil, I'm not going to name the places, but I tell my patients just throw it away in the garbage because you're going to have a lot of mercury. You're going to have a lot of mold. So you want good quality product. Yes. I get my product tested, so it's good quality product.
So you have potions. Yeah, you always tell me about the new potions you're making.
We do have like female metabolic syndrome packages.
And you make these packages.
Yes.
You make these packages handpicked by you. Nice. Okay.
And let's say male longevity, the same thing. We have packages online. And then also I have, of course, my anti-aging skincare, holistic skincare. Yes, my holistic skincare. And I told you I learned a lot about their traditional Chinese medicine serums, pure serums. But they also have the big kicker for anti-aging. Yes, hyaluronic acid and Swiss apple stem cell. But what's so wonderful about it, yes, you could purchase these things online. But also when you're getting the microneedling, it's an anti-aging procedure, okay? The microneedling, you will induce these serums 3,000% with the procedure. So that's really nice. And then 72 hours after procedure, if you use the product, and they're natural, so you're not putting these chemicals in your body, ladies and gents, like women who use the makeup that have the chemicals. So they're all natural skincare.
Nice.
So those are online on the website, yes.
Okay, and what do you have for bald people? I'm interested.
I do know. I do have a hair serum. Oh, okay. I do have a hair serum that is a natural serum. That's online too for hair restoration or alopecia.
Looking at me as you're saying it.
Yeah, I would be putting that on about 10 times a day.
Maria!
No, I'm just kidding.
That's cool. Okay, so and what else? So what else do you do at your clinic?
Ooh. Okay. a lot of fun things. First of all, I enjoy is with the wellness department. I do red light rejuvenation therapy. So a lot of you have heard about the red light, how it helps. The red light, the blue light, the green light, good for acne or whatever. In wellness, a lot of your movie stars will say, hey, I just got a anti-aging treatment and I had the red light therapy. Or for, let's say, a case for a diabetic patient or neuropathy, I will put it on the patient's legs, the red light machine, and I will put the acupuncture needles in. And I'll also use another lamp, which is it's a heat lamp, but it puts off infrared and 21 different minerals. So I'll use the infrared and the mineral lamp at the same time in the red light for treating different conditions. It could be for pain. It could just be recent surgery they just came out of. But while I'm thinking about it, I have 3 patients right now I'm treating for neuropathy. Very successful. Initially have them come in twice a week, then once every 2 weeks. And the gentleman who's coming in now, I think his last visit was like 2 or 3 months ago. So you just get them to maintenance, as we call it, as they get better. And obviously following a little bit of the natural pharmacy products. So I would put my neuropathy patient on it's called B Boost, a B vitamin, and a good quality fish oil. And sometimes one of my high antioxidant drinks, which is a superfood red. And then the red light we also use in anti-aging too. So after procedure, microneedling collagen induction therapy is what we call it, which is this little pen that I use that puts off about 8,000 to 18,000 RPMs, and it pulls up the skin. It's not like some of those imitation ones you see on TV where they just isolate and draw all this blood in that. Okay, that's not the way. Yes. So microneedling just pulls up the skin. It does create inflammation, which is good, and that's why it's really important that you use a good quality serum. And then putting the red light on after procedure. It doesn't matter what part of the body. If it's the arms, it's the stomach for scars or anything. They say wrinkles, it does beautiful. And for scars or anything after a surgery. I've used it for a lot of surgeries. And then you put the red light machine on for about 20 minutes. It runs hand in hand with the procedures.
Nice. So is your specialty pain? That's what I'm gathering? Is that your specialty?
I got myself into it because probably of my pain. I've had a lot of injuries myself, so I've been in pain management since 1993, and I've worked in a lot of rehab centers, and yes.
So this is this is much better because those pain pills, that's a big epidemic right now, right? People going through that. So
No, I worked with a lot of crabby people too when I worked for those pain centers, I told you. Pain's going to mean it's just like all that excess sugar. It's going to make you moody too and put your hormones out of whack, right? But at the same time, when you're on pain medication, I've worked with patients who came in who used to be on morphine and they gradually got off of it.
Actually, I'm going to ask you, can you tell us about a powerful case or powerful case that you had in healing someone?
Healing someone, I don't know where to go, but here we go. You just asked me, do I treat a lot of pain patients? Yes, but I also treat a lot, and I attract, I like to say, a lot of autoimmune, because I have a lot of autoimmune myself that I share on my website. If you take a look, and I have neurological, and that's how I come up with what I want to use regards to my natural pharmacy, how it's going to help me. I'm going to test it out, see how it works. But I would say my Epstein-Barr patients and autoimmune, I would say Lyme disease patients. I mean, we're talking patients who are in disability. I've loved the cases where they've been on disability, they couldn't do anything, and then, their quality of life changed so quickly, just making these steps, and now they're out there, riding a bike.
Yeah, that's powerful.
They're not doing a marathon, but they're riding a bike. They didn't completely follow my requirements, but no. They took their baby steps as I instructed, and yeah, I would say a lot of autoimmune patients, or we have patients who were going to have surgeries. One of them who was supposed to have carpal tunnel surgery, he had it scheduled, like you were talking about. He had it scheduled, and he came to see me. And we just did a few treatments, and I gave him the rehab, the stretches, the exercises. I didn't give a sheet and go home and do this sheet, okay? We did it together, hands-on, whatever's supposed to be. Stretch your hand out, whether you're going to use Epsom salt with cold water for after the treatment, because I'm going to cause a little inflammation when I do some massage in there, when I do the rehab in-house with him to show him how to do it. Yes, and then I do the acupuncture and the moxa, which is a burning herb at the end of the needles. And sometimes I do, you're talking about some of my toys at work. My machine, excuse me. We have this electrical acupuncture machine, and we just hook it up, and that will help with the healing process, facilitate the healing process. So a lot of success. Or another thing, finally, is I have an in-house. It's called a bioimpedance analysis. It's a FDA-approved cellular health testing. I like it. It's a very quick test. It takes about 10 minutes to get it done, but it shoots off a good report, about 16 pages, and it tells me about the patient's quality of their cells. Okay. And nutritionally, I can help them out with my products to let them know what they need more in their body.
Who are the type of people that come see you?
I see a lot of patients who have cardiovascular disease, diabetes, which when I see those, I have to say about 80% of them, almost 90, they both have diabetes and cardiovascular disease.
They go hand in hand, right?
Yes. And at the same time, speaking hand in hand, patients that are overweight, and that brings them into when they're overweight, hormonal issues.
Oh, really?
Yeah. And I do see I love it. Some of the oncologists will refer patients over for acupuncture for the side effects. Helps with their immune system, helps them with the, dizziness or nauseated effects of it, and just balancing them out.
So they send them to you so you can, that's pretty cool.
Yes, do that. And then also and then patients who've had procedures with skincare, the same. I have my before and after pictures that I do show online, and it's just amazing results just with 2 treatments where you can just show. And also I have to say that it's the quality of, your skin It has to do what you're doing on the inside too.
Of course.
Okay, if you have, you could see the liver spots, or you want to call it the age spots, or you want to call it the hormone spots, the brown spots. I mean, it's about, and that's why I recommend for these aesthetics patients for them to definitely do some holistic, some nutritional support at the same time.
What do you do? What does your red pill do that's different than the blue pill? Like if somebody's making the choice of who to go see, like what are they not doing? What are the what did you call them?
Well, it's known as a standard doctor or conventional doctors because they treat the symptoms.
The symptoms.
The symptoms, yeah. So how we look at it in functional medicine is a functional medicine tree, and the leaves, when they're yellow, those are the symptoms. You're treating the symptoms. So you want it to give it, if you look at the roots, because functional medicine doctors treat the root causes of the disease. So what are you feeding those roots? What type of soil to make those leaves on the top green again? So if you have anxiety, those yellow leaves are turning yellow. You have depression or fatigue, diarrhea. I can just list all the things when I had, mercury poisoning, joint problems, breathing problems. Those are the yellow leaves. But on the very bottom, the roots of that tree, you got to look at that. What are the nutrients? I mean, look at the lifestyles or lack of movement if you're in joint pain or whatnot. Lack of movement that you're doing if you're doing no exercise. What about your lifestyle? Who are you living with? Where's the stress in the household? Okay, GMO, we were talking about foods early. Maybe food is your medicine. I mean, that goes back in 400 BC. Food is your medicine, medicine is your food, and that still hasn't changed. It's the same thing. So you want to look at root causes.
All right. So one last question, right? And I really want people to know this. I really want people to know this. So you ran an Ironman, right? You did an Ironman.
Half.
I've done an Ironman.
A half Ironman.
Half Ironman. Big difference. Yes.
I've done 6 of them. I've done half marathons. I've done Olympic triathlons, Olympic sprints.
My question is, I promise it is, coming from the barriers you came from, what pushed you to I don't know, that's a big difference. So
it's not human.
Well, I would say maybe you're not. No.
Okay. There was roadblocks. I learned not to, I'm not telling you not to listen to your doctors, okay? I don't want to get in trouble, but I've been told when I had a couple of hand surgeries, when I was in my bicycle accident, when a pickup truck hit me, okay, on the trail, I was, okay, so yeah, and that's online on my website, by the way, but I know we're trying to end here, but if I let those people or even the outside world, we hear them all the time, you can't do it, I'm telling you, you can do it. You can do it. Set your mind to it. Write one goal if you have to. 2 goals is hard than just one goal. You can do it, but you got to remind yourself, not just once a week, once a month. I mean, you need to remind yourself, if it's twice a day, every morning, every evening, that you're going to do it. You can do it. You can do anything you want to do. And I promise you.
Yeah,
You can do anything you want to do, because I've had doctors that tell me, that look up to me and said, my friend who has a practice shut down his practice because of what you have, Maria. I mean, he tells me he looks up to me, okay? But I really say, stick around those positive people in your life and share your story. Sometimes you maybe want to share your story, maybe keep it to yourself for a little while if you have to, but you can do it. You can do anything you set your mind to.
The human spirit is a huge factor.
Yeah, it's the mind.
And the belief, yeah. It's everything, right?
It's going to take time. Nothing's not easy in life. Nothing's not easy in life.
That's what makes it beautiful. The heartaches. So when
we grow. Yeah, we grow through all those challenges. I can't tell you, and that's why I'm writing my memoir right now, is we grow through all of these challenges, and that's what's beautiful. But it's when you're going through the challenge, it is tough. It's like, well, what am I going to think positive about, having these diabetes?
You got to find it.
But if you look back, even just a month, you're going to notice a little bit of a change, even 2 months. Just look back and you've made progress, but every day is a working day.
All right. So anything else you want to leave off, you want to tell people?
I am located in Lake Mary, Florida.
Visit me.
I'm located in Lake Mary, Florida. Come visit me.
What's your address? Say your address.
3525 West Lake Mary Boulevard. And I also do free fitness groups, usually every other Friday. So if you want to check that on the website, so if you want information, like I said, it's free, so you can bring a friend. And I do have every month or every other month functional medicine wellness workshop. There's small ones, but so limited seats inside the practice. So if you need information, I mean, they're full of information. They're only about 1 hour. I give you the cliff notes of it, the short version too, and give you handouts so you can learn things. And afterwards, you could speak to me or before. So there's, and I encourage you just to, don't give up. And, I'm here to, as I say in my mission statement, empowering individuals with personal health.
Nice. Well, thank you, Maria, for joining me. Please keep doing what you're doing and empowering people. Health is everything. And as long as we have warriors like you fighting for the health of our community, we will make it. Thank you for joining me.